GLP-1 medications have changed how we treat obesity. Some people lose 30, 40, or even 50 pounds, while others lose almost nothing. And that's where confusion, fear, and frustration come in. So today, I would like to explain clearly and honestly how effective GLP-1 medications really are, what good results actually look like, and why they sometimes don't work, and what do you need to watch out for. No hype, no social media nonsense, just medical truth. So if you are on GLP-1s or thinking about starting to be on one, or wondering why it's not working for you, this video is for you. Well, what is GLP-1? GLP-1 is a hormone naturally produced by the body, and it is released when you eat. The function of the GLP-1 is to tell your brain that you're full. Number 2 is slows down food from leaving the stomach. And number 3 is reduces appetite. And number 4 is improves insulin response. GLP-1 medications copy that hormone, but stronger and longer. And here's the important point. These medications don't burn fat. They are not fat burning medications. They don't speed metabolism, and they don't melt weight away. They change hunger biology. So how much weight do people lose with GLP-1? On average, on Semaglutide, which is Ozempic or Wegovy, about 10 to 15%, while Tirzepatide, which is Zepbound or Mounjaro, about 15 to 25% weight loss. So let me give you an example. If someone weighs 200 pounds, 10% is 20 pounds, 15% is 30 pounds, 20% is 40 pounds. For someone going from 200 to 170 is very normal medical response. That doesn't happen in 1 month. It happens over 6 to 12 months. So even losing 10 pounds from 200 to 190 is still medically meaningful. So what good response actually looks like is not what you think. It's not about losing weight fast. A good response doesn't always mean fast weight loss. A good response looks like appetite is quieter, smaller portions feel satisfying, less food obsession, and fewer cravings, and weight slowly trending down. For example, patient A loses 2 pounds a month. That means 24 pounds a year. That's a good response, and that's success. So why GLP-1s don't work for some people? Well, that's a very important section, and there's a lot of people who are on GLP-1 and they feel frustrated because they are not losing weight. Reason number 1 is dose is too low. Starter doses are not treatment doses. If you're stuck on a low dose for a month, you are basically warming up the engine and never driving. So a patient stays on Semaglutide 0.25 milligram for 4 months and they only lose 3 pounds, they think the drug failed. It didn't fail. The dose was never therapeutic. Reason number 2 is eating through the medication. Well, GLP-1 reduces hunger, but they don't block eating. So if you're not hungry, but you're drinking sweet coffee or juice or alcohol or protein shakes with sugar, liquid calories bypass fullness, and the medication cannot protect you from that. Reason number 3 is ultra-processed food overrides biology. At least this is how they engineering it. Highly processed foods are engineered to bypass fullness. So if you're not hungry but you're eating chips, you still feel not full and you keep eating chips. That's not failure, that's food chemistry. Number 4 is severe metabolic adaptation. Well, years of dieting will slow down your metabolism. Here's an example. Two people taking the same medication, the same dose. One loses 30 pounds and the other loses 10 pounds. Same medication but different metabolic history. That doesn't mean it won't work. It means expectations need adjustment. Reason number 5 is medical blockers. GLP-1s don't fix poor sleep, chronic stress, undiagnosed hypothyroidism, steroids, and some psych medicine. So if you sleep only 4 hours a night, your hormones are fighting you. So what are the biggest mistakes on GLP-1s? Mistake number 1 is eating too little protein. Low protein leads to muscle loss, and muscle loss slows metabolism. So aim for 80 to 120 grams of protein daily, adjusted to body size. Mistake number 2 is no strength training. So if you only lose weight but don't protect muscle, you know what's going to happen? You will plateau. Mistake number 3 is stopping too early. Most weight loss happens after dose escalation, so you have to be patient with yourself. So what are the side effects to watch out for while you are on GLP-1? There's common side effects like nausea, constipation, reflux, and fatigue. But these are usually manageable. But watch for these serious side effects like dehydration, gallstones, rapid muscle loss, and vitamin deficiencies. And here is the red flag. If food stays in your stomach for a long time or vomiting is persistent, that needs evaluation. So what to do if you're not losing weight on GLP-1s? If you're not losing weight, first thing, do not quit. Do not quit. Do not quit. Ask yourself these questions. Am I on the right dose? Am I getting enough protein? Am I lifting weights? Am I sleeping well? And are there medical blockers? You need to have a plan adjustment. Increase dose slowly, switch to another GLP-1, add protein targets, and add resistance training. This is medicine. It requires adjustment. So how long should you stay on GLP-1s? Well, obesity is a chronic disease. When you stop the drug, hunger biology returns, and most people regain about 2/3 of their weight back. That's not addiction, that's physiology. For many people, long-term use is reasonable. Maintenance doses work, but you need to change your lifestyle as well. Lifestyle still matters. So who shouldn't be using GLP-1? Don't use it without caution if you have a history of medullary thyroid cancer, severe gastroparesis, active eating disorder, or you are pregnant or breastfeeding. This is not cosmetic medicine. This is real medicine. Well, GLP-1s are tools. They are not magic drugs and they are not shortcuts. You need to change your lifestyle as well. They work best if you use them at the right dose, combined with protein, combined with strength training, and you're monitoring yourself medically on a regular basis. If it's not working, you are not broken. The plan needs adjustment. But if it's working, protect your muscle, protect your nutrition, and protect your health. Weight loss is not about willpower. It's all about biology. If this helped you understand your body, please subscribe. Thank you for trusting Dr. Nony's Power Lab. I will see you in the next video. Thank you.